What antibiotics are safe for pediatric UTIs? Imagine your child is feeling uncomfortable and you find out they have a urinary tract infection. It's common in children and needs quick treatment to prevent more serious issues. But which antibiotics are safe and effective for kids? That's what we're here to explore. When treating urinary tract infections in children, doctors relying on antibiotics approved by major health authorities. The goal is to choose medicines that are both safe and effective based on the child's age, how serious the infection is, and local bacteria resistance patterns. One of the most common first choices is cephalosporins. These are a family of antibiotics that work well for uncomplicated urinary tract infections. For mild cases, first-generation cephalosporins like cephalexin are often used because they are well tolerated and effective. For more severe infections or when broader coverage is needed, third-generation cephalosporins such as sulfoxam or ceftriaxone may be prescribed. These antibiotics are generally safe for children when used as directed by a healthcare professional. Another option is trimethoprim sulfamethoxazole, often called TMPSMX. This combination antibiotic can be effective for uncomplicated urinary tract infections in older children. However, resistance to this medication has increased in some areas, so doctors consider local resistance patterns before prescribing it. Nitrofurantoin is another safe choice for treating lower urinary tract infections, especially cystitis, in children over 1 month old. It is not suitable for upper urinary tract infections like pyelonephritis because it doesn't reach high enough levels in the kidneys. Nitrofurantoin is usually well tolerated but should be avoided in infants under 1 month or children with certain kidney issues. Amoxicillin clavulate is a combination antibiotic that can be used, especially in younger children or when other options are limited. Its effectiveness depends on the bacteria causing the infection, and resistance can sometimes limit its use. Ciprofloxacin is generally reserved for complicated urinary tract infections or kidney infections in children. It is not a first-line treatment because of potential side effects and concerns about bacterial resistance. Doctors usually prescribe it only when other antibiotics are not suitable. The length of treatment varies. For infants and children with kidney infections, antibiotics are typically given for 7 to 14 days. For older children with simple bladder infections, a shorter course of 3 to 7 days is often enough. It's important to remember that all antibiotics can cause side effects, like allergic reactions or stomach upset. They also carry the risk of bacteria becoming resistant to the medicine. That's why antibiotics should only be used when prescribed by a healthcare professional and taken exactly as directed. In summary, cephalosporins, trimethoprim sulfamethoxazole, nitrofurantoin, amoxicillin clavulate, and sometimes ciprofloxacin are safe and effective options for treating urinary tract infections in children. The best choice depends on the child's age, how severe the infection is, and local bacteria resistance patterns. Always consult a healthcare provider for personalized advice and treatment.